In our summit rounds several months ago, we read an article published by a surgeon at Vanderbilt who described a protocol for patients to wean off of or get off of narcotics before surgery, and then to perform surgery with no narcotics. And this was really a fascinating and well-written and well-devised study. This idea that getting off of narcotics before surgery is counterintuitive, because you think that you need the narcotics because you have a problem, and then that you'll have surgery and then your problem will be fixed and then you'll get off the narcotics. And what this surgeon at Vanderbilt found is that patients typically don't naturally come off the narcotics after surgery. Their best opportunity to decrease the narcotics is before surgery for two reasons. One, the pain control after surgery for those patients that are off narcotics before surgery is much better. And number two is their risk of surgery is lower. So we have started recommending that patients wean down on the narcotics as much as possible, and if possible, to come completely off. That recommendation led to lots of questions and some trepidation that patients had. The other problem that we had was patients didn't know how to do that. We could say to them, well, try to cut back on your narcotics before surgery, but that's not necessarily an easy thing to do. So we've implemented a program to help patients wean off narcotics before surgery. And so far, the program has been, I think, very successful. Patients have gone through the program and have then gone through surgery and felt like it was a wonderful thing for them to do, and they have felt like they got their life back. We have found that weaning off narcotics over a few weeks is an appropriate time frame. Also, the program is through daily coaching and encouragement, where the patients have close contact with our nurse practitioner. Lindsay is the one that does most of this currently. She's amazing. She's very attentive to the patient's needs and very comforting and not judgmental at all. And I love that about Lindsay. Patients can have symptoms and side effects from weaning down, and she can help manage that medically and also help with the encouragement. The patients have the opportunity to visit with a nurse each night, and that again is this ongoing encouragement and coaching. It's not an easy thing to do, but the patients have found that it is so much better to be off of the medication, and then they have gone on to have successful surgery. One patient said, "I'm secretly becoming myself again." And his wife said, "I finally have my husband again." Another patient said, "I can't believe I made it through. I would recommend it to anyone." Another one said, "I knew I needed to get off opioids. Lindsay helped me overcome my fear and anxiety and accomplish my goal." We need to think about narcotics as a short-term solution to acute pain, to be used sparingly at the lowest dose possible and for the shortest period of time. Patients that are on narcotics for any length of time should consider weaning off. And I think that this program is a successful tool that can be used to help you get off narcotics.